In our country, Black birthing people are 3 to 4 times more likely to die from pregnancy-related complications than their white counterparts. And for every death, we have 70 near misses. It is the consequences of systemic racism in our healthcare system that one group of people, right, Black birthing people, continue to have these awful birthing outcomes where not only is baby impacted, right, but infant mortality rates have gotten a lot of attention over a number of decades. But maternal mortality is something that I found has really united so many of us as Black women. But we think it's just us. So it might just be that new mom who had a really challenging delivery thinking that she did something wrong. Or we all have a girlfriend or a sorority sister or a neighbor or a coworker, right, that has gone through this either severe morbidity or mortality. And we think of it as these isolated cases, but unfortunately, this ends up almost being like a sorority that unites us as Black women. So when I got into Congress in April of 2019, I teamed up with Alma Adams, who's a congresswoman from North Carolina, and we co-founded and co-chair the Black Maternal Health Caucus, which is a group of members of Congress committed to ending our nation's maternal mortality crisis. And it quickly grew to over 100 members, bipartisan, with incredible enthusiasm in the Senate. In the spring of 2020, like literally 2 weeks before COVID, the shutdowns happened, Senator Harris and I introduced a bill that we call the Mommy Bus to address every clinical and non-clinical driver of these disparities. Since Senator Harris is now the vice president, we have reintroduced this legislation earlier this year with Senator Cory Booker, added 2 bills to the package related to COVID because there's a dangerous intersection between COVID-19 and pregnancy, in particular for Black and Hispanic moms. And we added a bill related to climate change because there was a study published in the summer of 2020 documenting the impact of extreme heat and air pollution on maternal health outcomes. And so we knew we had to take action. So now we have 12 bills in the Mommy Bus, and we're making great progress towards enactment.